Flipped. That's not working right.
And Patience, if you're still there, will you just give us the cue for when you want to start or how long you want to let people trickle in?
I think let's give it a minute for folks to trickle in and then we'll go ahead and get started.
Okay.
Hi, Lindsay.
No. Oh, there you are. Sorry. I'll let.
I know. This is weird. I just tried this screen and it feels like I've got like this cutout head. It feels really weird. Not sure if I like that or not. I think I might go back to my same old me with all my junk in the background. There we go. That's more like me.
That looks great, Elisa, from the audience.
Okay. Well, I think we've got a lot of folks on the meeting today, so let's get started. Good afternoon and welcome to the 6th Affordable Housing Week kickoff. I think we're going to move to a slide to get us started. Here we go. We want to acknowledge that we are all, wherever we are today, on the unceded ancestral land of the Coast Salish peoples, the traditional home of all tribes and bands within the Duwamish, Suquamish, Tulalip, and Muckleshoot nations. And my name is Lindsay Masters. I'm the executive manager of ARCH, which is a regional coalition. We are a coalition of 15 Eastside cities and King County working together to create affordable housing.
Hi, everyone. I'm Angela Sanfilippo. I'm the executive manager of South King Housing and Homelessness Partners, or SKIP. And we are the cousin to ARCH, a coalition of 9 cities in South King County, as well as King County in the South King County subregion. Subregional partnerships like ARCH and SKIP provide a coordinated approach on housing policies and programs, and permanent supportive housing is an effective and important housing type in the overall housing continuum. Permanent supportive housing helps reduce homelessness and achieve housing stability across King County.
So this is a special day where every year housing advocates, elected officials, community members, and others come together to kick off Affordable Housing Week and talk about the regional housing crisis and, more importantly, the solutions to address it.
This year, we recognize the deep connections between healthcare and housing amid the most challenging public health crisis overlaid on the existing housing and homelessness crisis that preceded it. Today, we're kicking off Affordable Housing Week with a discussion on housing as healthcare, solving homelessness with permanent supportive housing. This is a learning opportunity on permanent supportive housing as a solution to homelessness and why this approach works. You'll come out of the event with an understanding of what permanent supportive housing is and why it is a critical solution to homelessness in our region. We want to take a moment to recognize our partners in co-hosting this event. You'll see these on your screen. These include HDC, Seattle King County Coalition on Homelessness, the North Urban Human Services Alliance, or NUHSA, Plymouth Housing Group, DESC, and the Southside Chamber of Commerce. And now we also want to recognize and thank the generosity of our sponsors for Affordable Housing Week. And those are listed on your screen as well.
So as Angela mentioned, this event is really timely for all of us. I also wanted to just make a brief mention that this is the first time ARCH is supporting a permanent supportive housing project right now, happening on the East Side, which is an exciting partnership between Plymouth Housing and Congregations for the Homeless that we hope is going to be a model for more housing to come. And so really appreciate this moment to help spread awareness and a deeper understanding of what PSH is. And now I'm pleased to get this event started and introduce you to Debbie Thiel, who is going to help moderate our expert panel. Debbie is Managing Director for the Corporation for Supportive Housing, where she oversees technical assistance, policy advocacy, and systems change efforts to end homelessness and unnecessary institutionalization in the Western region. She previously served as the lending manager for the Seattle Office of Housing and as homeless housing director for the King County Housing Authority. Debbie is also a commissioner for the Seattle Housing Authority and a board member of the Third Door Coalition. Her work is rooted in lessons she learned early in her career from people who have survived homelessness. I'm fortunate to have worked with Debbie in my own career and happy to introduce her. Take it away, Debbie.
Thank you so much, Lindsay and Angela, for that really lovely opening. And hello, everyone. It is just wonderful to be with you today to talk about my favorite topic, which is supportive housing. And I'm thrilled and honored that HCC is recognizing it as the focus of the Kickoff to Affordable Housing Week. So thank you, HCC. And I'm just going to give you a little bit of an overview of what you can expect from this session. As Angela and Lindsay said, this is really a level set. So our goal today is to help you understand what supportive housing is and the fact that it already is a solution in our communities across King County, and to learn more about the different perspectives on it and how you can help advance it to make sure we have enough for everyone who needs this solution. So first, we're going to hear from Brooke Page, who is the director with my organization, CSH, or Corporation for Supportive Housing. And Brooke will give you an overview of what supportive housing is, who it serves, and how it's structured and funded. And by way of background, our organization, CSH, is a national mission-based nonprofit that helps communities create supportive housing to improve their responses to the housing and service needs of people with extremely low incomes. So after you hear from Brooke, then we're going to hear from 7 people in our communities across King County that have expertise on this topic and are either operating supportive housing or financing it or connecting with it in some positive way in their communities to help improve community responses. Once we move through these initial questions, if we have time, and we hope to have time for a few of your questions, we'll get through as many as possible. So you can start plugging your questions into the chat. We're just going to use the chat function for questions today because we're kind of limited on time, and we want to make sure we get to hear from all the panelists and get to as many of your questions as possible. So patients will be fielding the chat and then sending questions back to me after we hear from each of our panelists. So with that, I'm going to turn it to Brooke Page. Thank you.
Wonderful. Thank you so much, Debbie. And hello, everyone. I'm going to share my screen and go over some level setting on what is supportive housing. All right.
And Brooke, we have the annotated version.
Annotated version.
Clicking into the full presenter mode.
Okay. Yeah, it's got a little hourglass, so it's thinking.
Great.
Okay. Technology, work with us today. Do you see an hourglass, Debbie?
Yep, I can see things just got a little bit frozen. Let me see what I can do on my end. Thanks
Okay.
for your patience, everybody. All right, it wouldn't be a virtual event with a little tech, without a little tech hiccup. Brooke, why don't you go ahead and start, since you know what you want to tell everybody about supportive housing, and I'll see if I can get the slides loaded.
Okay, wonderful. So to level set on our topic of supportive housing today, I'm going to talk and walk through the definition of what supportive housing is and who it serves, the housing, the services, and how it's created. Supportive housing is affordable housing, where supportive service providers actively engage tenants in flexible, voluntary, and comprehensive services, and work with property and housing managers to support tenant stability and ensure that the housing remains a community asset for the long term. Supportive housing is permanent and tenant-centered. It is often referred to as permanent supportive housing, and to clarify, it is it's not time limited, is essentially what that means. As supportive housing is tenant-centered, tenants may choose to move on from supportive housing, and service providers help them to do so, but they are never forced to move from supportive based on arbitrary time limits, because it is their home, right? And we want folks to stay there and live there as long as they want to. Supportive housing is flexible, and it provides voluntary services that helps tenants access and remain in supportive housing, as well as connect with their family in the community, or maybe access employment, manage their addiction, and manage mental health challenges, and improve their overall health. Supportive housing provides a platform to help tenants thrive. So I see slides. Thank you, Debbie. Go on to the next slide. So who is supportive housing intended to be served? Let's dive into who this intervention is for. So supportive housing is for the households who, without services, they're unable to access and maintain housing, but without the housing, they're unable to effectively access services. And, a common denominator from all the groups that you see on your screen is that they have extremely low incomes. And so we're talking mostly about people on fixed incomes, seniors on Social Security supplemental income, people with disabilities on Social Security disability income, and people who have no income at entry and need support in accessing entitlement income, supported employment, or employment. Populations in this category can include many of those on your screen, and compared with other very low income people, these men and women make the highest use of our shelters, our healthcare, and our public mental health services, because the housing and the services that they need are not available to them. As a result, many end up cycling through various public institutions at great cost to taxpayers. Supportive housing, though, can break this cycle by providing affordable housing and the services that these individuals or families need to remain stably housed. Next slide. So CSH has developed a racial disparities and disproportionality index, also known as the RDDI. And if we can go down a little bit here. And so the RDDI looks at 16 unique systems and measures whether a racial or ethnic group's representation in a particular public system is proportionate to, over, or below their representation in the overall population, also known as proportionality. It also allows for the examination of the systemic differences between groups and geographies or disparities. So you'll notice on your screen, in Washington, you can see that American Indian, Alaskan Natives, and Black people are engaged with these systems at rates that are significantly higher than they are represented in the overall general population. Next slide. So housing and services. Now let's look and see how the housing and the service models make up supportive housing and how those are effective. So, supportive housing is rental housing in your community. Supportive housing ensures that tenants are offered opportunities to live in the type of housing that best meets their needs and their desires and supports their ability to participate in the community. Tenants are offered a choice. And, in a perfect situation, they're offered multiple choices, multiple units of housing. And if possible, they're given choice about whether or not, they want a certain type of housing model and a certain location that they want to live in. Staff understand the tenant's needs and support them in this process of searching for and selecting a unit based on their personal choice. Identical to tenants in non-supportive housing, supportive housing allows for tenants to have a lease or a sublease that is identical to those of tenants who are not in supportive housing. So ideally, the term of the lease is about 1 year or more. And tenants have a clear understanding of their rights and their responsibilities because staff walk through the lease agreement with the tenant and they clearly explain to them their rights and their responsibilities. The tenant is given a copy of their lease as they are notified of the process for lease violations, the grievance procedure, and the appeals process. And tenants should also be supported in requesting and maintaining reasonable accommodations in order to successfully continue their tenancy. And lastly, there's no service participation requirements in supportive housing. And so like tenants in other non-supportive housing buildings, tenants in supportive housing should not be evicted for choosing not to participate in services or for not taking their medication or for not being sober. Supportive housing strives to prevent eviction, but when it is necessary to evict for lease violations, ultimately, such as not paying their rent on time. And staff will not remove a tenant from housing without going through the proper legal eviction process.
I like your sandals. They look like Jesus.
All right, next slide. So supportive housing can be established in any type of housing. It could be a single apartment building, an individual apartment in the community, or integrated within a larger apartment complex. And next slide. Supportive housing uses a housing first approach. And by helping people get back into housing first, it enables barriers and expedites opportunities for tenants to rebuild their lives. So let's talk a little bit about housing first. Next slide. So housing first does not mean housing only. Instead of requiring tenants to participate in specific services and attend meetings, supportive housing flips that old paradigm of housing ready on its head by using evidence-based practices like harm reduction, trauma-informed care, assertive engagement to help tenants take advantage of the services they want and need to rebuild their lives. Next slide. So now let's go into how supportive housing is created. Next slide. So there are 3 legs of the proverbial supportive housing stool that are the resources needed for capital, operating, and support services to make a project pencil. The capital financing is the funding for both the hard and soft costs of new construction and rehabilitation, things like land acquisition or construction costs. Also, the architectural design are all of these things that are needed to build and develop new units. The operating sources, the second leg of the stool, cover the gap between the costs of operating a building, which is the things like keeping the lights on and the utilities, or paying the property management and the maintenance staff, and what the tenant can actually afford to pay and rent. So that gap is what we're looking for when we talk about operating sources. And the service dollars cover the costs of support services for tenants. Things like case management, mental health services, which may be provided on-site or off-site. And in the panel today, you'll hear more from our speakers about some of the specific new sources that are available to address all three legs of the stool in supportive housing. Next slide. Key stakeholders are important to this opportunity to leverage these important resources because many of these dollars for the three legs of the stool sit in specific jurisdictions like a city, a county, or are oversaw by the housing authority or another state agency. And to have a comprehensive planning discussion where decisions about allocating these resources or developing things like a joint notice of funding or prioritizing a specific population, where these conversations are made, the folks listed on your screen should definitely be considered in these planning conversations. So the first group of folks are the funding and entitlement agencies, and those that have an interest in expanding access to high quality supportive housing, which includes our government agencies, our housing authorities, and our elected officials. Also, we need culturally responsive, affordable housing developers who have the capacity and the interest in creating high quality supportive housing. Also, our people with lived expertise that can help drive strategy, that expands access to supportive housing, and really helps shape the quality in the services that are being provided. Also, our culturally responsive supportive housing and emergency shelter providers who have an interest and a capacity to deliver high quality housing and services. And also some key partners that are not on your screen, but are very important are our business community, which can be both leadership and investment in siting and creating the supportive housing. Also intermediaries like CSH who can help translate between funding streams, sectors, and partners to maximize resources and impact. Next slide. So with these key players positioned in a community where there may be some opposition, there may be some political dynamics, or there may be advocates that are posturing for priorities for other populations. When all of these folks are navigating these conversations, it is then that proverbial three-legged stool turns into a full-fledged community table where we can strategize, where we can work together, where we can solve some of our community's most difficult problems. Affordable housing is one of those problems. And I invite you all today to have a seat at the table, a table that I hope is committed, transparent, diverse, and ready with innovative solutions. So thank you so much. I'll turn it back over to Debbie. Thank you for the opportunity to present on supportive housing today.
Thank you so much, Brooke. And just as a reminder, we are going to go to our panelists next. So if we can get them spotlighted, and I'll be asking a series of questions for each one of them. And if you can put your questions in the chat, we'll be sure to get to them as soon as possible. But I want to make sure that you hear not just from CSH, but from other members of our community here in Seattle, King County, and all of the cities across Eastern King County and Southern King County. Good, I see the panelists coming in and really hear about how this is going in your community. So I want to start with Andrea Reay. Hi, Andrea.
Hi, Debbie. How are you?
Great. How are you?
Doing well. Thank you so much for inviting me to be part of the discussion today.
Thank you for being here. I really heard what Brooke said about the importance of leadership and investment from the business community. Andrea, you represent the Southside Chamber of Commerce, and I'd love to get your perspectives from that seat. It's really been wonderful to see members of the business community learn about how we can end chronic homelessness together by creating enough supportive housing in King County. And I know as a member of the Third Door Coalition myself, how exciting it is to work with a whole new sector of thoughtful leaders. It just seems like until recently, those of us in the nonprofit and government sectors who've been working on these issues for years have been mostly talking to ourselves. And I welcome your interest and your engagement. And I just would love if you could tell us all, you know, what do you need? What does the business community need from those of us with professional lived expertise in this arena to encourage and support your engagement?
Yeah, I really appreciate that, Debbie. And I think events like today are obviously kind of that first step, right? So just inviting the business community to be part of the conversation and finding ways where we can create more education and outreach opportunities, which is so critical as we're all working to, you know, build awareness and understanding for the complexity of what the housing crisis truly is within the greater Puget Sound area. The business community very much wants to be part of this solution finding as we look to create more housing choices in the Puget Sound, and businesses very much are on the front lines of the housing crisis. And we know that we need more housing choices, all housing types, to advance economic development and create more economic equity in our region. And by adapting a collaborative approach just to bring together organizations and individuals, we can kind of start to get out of our silos that we kind of tend to just naturally, you know, self-segregate into, and look at what are those creative solutions to those complex problems, and start to solution find, right? The business community wants to be part of the solution finding process. And I'm confident that with a collaborative approach, we can start to find those broad-based solutions that meet the housing needs of our community and help us grow for the future.
Wonderful. Thank you so much. Well, hopefully, as you said, today is the day to have that engagement happen. And I'm going to turn next to someone who has been doing this work for quite some time and has a lot of expertise, Daniel Malone, who is Executive Director of the DESC, which is really a nationally recognized supportive housing provider. Daniel, I'm going to take you back in time a bit and ask you about Housing First. So back in 1987, our country adopted its first federal policy on homelessness. And back then, we kind of all thought as a country that people who were experiencing homelessness needed to graduate through a continuum of shelter to transitional to permanent housing, and that each of these steps would be rewards for participation in services. And we've learned now over the years that this approach not only failed to demonstrate any tangible outcomes, but it really perpetuated suffering for people who are living through a difficult situation. And since then, DESC decided to change that paradigm and really listen to people who are having this experience of homelessness. And you pioneered this Housing First approach that's so important to supportive housing. So tell us more about that secret sauce and why Housing First works so well and how we know for sure if it does.
Oh, great. Thank you, Debbie. And thanks to HDC for putting on this event today. So I try to think about these issues as I think about my own life and about other people that I know, where I think a common feature is that people want to be in control of their own lives, in control of their own domains. And the system that you described there, that was the conventional improve and then move kind of system that existed for many years, is one that does not recognize that people have control over their own lives. It is putting people into a structure that says they shall conform and achieve certain things, and then they are able to be rewarded with something. And we saw over and over and over again that too many people failed in that system. And when you ask people what it was that they wanted, in various ways, people had a way of telling you. Sometimes they could articulate it directly, and sometimes they told you over time by the choices that they made that what they really wanted was a safe, decent place to stay like the rest of us, and then to have their own ability to think about what their goals were in life for themselves. And for some of them, that actually meant having a period of time to think about the prospect of thinking about goals in their lives, because survival mode is all encompassing for people living on the streets, and it is very difficult to think about what you want to do next in life. And so a housing first approach that basically says, let's strip away the chaos of homelessness from folks' lives on a day-to-day basis, provide them with that basic thing that we all need, a home base from which to thrive, and then see what it is that they want to do with the rest of their lives. And with that sort of self-directed decision-making that you and Brooke talked about in the definition of supportive housing, it became really clear that everybody's unique and individual, and people will make good choices for themselves when the circumstances allow for it. And if we as service providers can be servants to the people that we are serving, we see far more success than when we are asking them to conform to our idea of what they ought to want for themselves.
Thank you, Daniel. Thanks so much. I'm going to ask Chief Boe to jump in here. And Chief, as we think about that framing that Daniel presented and what Brooke mentioned in terms of people involved in the justice.
I said Pedro doesn't know we're going.
Just a quick reminder, everybody, to put themselves on mute. Thank you. Chief Boe comes to us from the city of Burien and offers this really important perspective on from law enforcement. So could you tell us, Chief, how these themes that you've heard from Daniel and Brooke present themselves in your work day to day, and how supportive housing can be a solution?
Sure, absolutely. And thanks for having me. I am the Chief of Police down in Burien. I've been working in this field for about 3 years. And by this field, I mean as the Chief of Police in Burien. I didn't start out as the chief. That would be quite impressive. One of the things I discovered early on is that when we start talking about public safety and this interaction with people who are unhoused, police get put in that situation all the time of having to try and find solutions to these problems. And over the last 3 years, I've really worked on defining what the problem is. And that's where I think most of my growth has come, is really defining what is public safety, what is the actual concern of the business community, and how can we unpack that box a little bit. And what you often find is there's two different concerns, and we're talking about them as though they're one thing. One is actual crime and safety. One is a perception of not feeling safe, which are two very different things in police work. And actual crime and safety a lot of times is something for which we have more of a traditional response to, but we're applying that traditional response way too often to a perception that is not a law enforcement or a crime or safety issue. And what I mean by that is we're dispatching police to things that don't necessarily have a criminal nexus, but are legitimately making a business or a person feel uncomfortable. And I think this is really where permanent supportive housing makes the most sense to me. Often those issues are 100% resolved by having a housed environment and having those supports in place, so that we don't have that interaction between the business community and law enforcement that's completely avoidable by just solving the obvious piece, the housing piece. And I think we talk harm reduction a lot in Burien and a lot in this work. We obviously have done a lot of work in LEAD and co-lead and other programs within Burien to really try to expand this services-based approach, not a criminal first approach, but rather a service first approach. And I think what we've really discovered as we've built that out is housing is one of those things that would support a services-based approach and give us another tool to not only meet the needs of the business community, also meet the needs of those who are unhoused, and most importantly, meet the needs of the officers who are often caught in the middle of this very discussion that is not even the place where they should be in a non-criminal matter. So I'm super excited for the idea of permanent supportive housing. I think it certainly builds out our approach here in Burien to a services first way of solving problems in our community. And I think it is about listening to the community. I think it's what they're asking for is to solve some of these problems. So thank you for having me on the panel, and much appreciated.
Great, thank you. Really appreciate your perspective. And building on that, I want to ask Elisa, who also is working with people directly. Elisa Tedinski from the Sophia Way in East King County, thank you for being here and offering your perspective as a shelter provider. I think when members of the community think about serving people experiencing homelessness and especially chronic homelessness, they first think shelter, right? We got to build more shelter. And what we're talking about today is really a housing-based approach, housing-first approach. As a shelter provider, tell us why you're interested in permanent supportive housing.
Oh my gosh, absolutely. Thank you so much for having me, Debbie. You know, we do a lot more than shelter. And I guess to me, I always look at shelter being that first step of getting people in to where they feel safe and we can help stabilize them. And working on those trauma-informed care principles, we meet women primarily where they are and help them determine what they want. Again, we talked about that strength-based support. And if it, you know, the other part that we talk about is that home can be a lot of different ways for a lot of different people. And for some people, it might be moving back to a family member. For some, it may be in their own apartment, or for a large portion of the women that we serve is permanent supportive housing. We believe probably about 1/3 of the women that we serve here on the East Side would be perfect candidates for permanent supportive housing. And as you know, right now there aren't enough spots for us. So I think for us, it's helping us move on those steps from shelter into safety and stability. I think we chatted at one time, you talked about shelter being the be all and end all. We believe it's that first step, that it's really not a destination, but shelter is a process. And how do we move women on that process to where they need to be?
Thank you so much, Elisa. I think you touched on something really critical, that we do know the need. We know the evidence base, we know what works, and we don't have enough. And that's really where we are as a community today, to draw on our strengths as a community with a proven intervention and take it to scale. So Representative Macri, I'd love to hear from you about this unprecedented session at the state legislature. I just want to thank you for your tireless work and the incredibly strategic way you've gone about this work. There were so many accomplishments this session, and I'd love to hear about all of them, but today we're talking about supportive housing specifically. So what can you tell us about the new resources that can help us take supportive housing to scale?
Yeah, thank you, Debbie. It's great to be here. And we are coming off some call historic session, particularly when we look at issues around housing stability and behavioral health care. And of course, supportive housing really meets at the intersection of those two issue areas. And the investments in supportive housing have been building over many years. I would say the legislature first came to this work really by prioritizing resources into building housing, and specifically building housing for people with serious behavioral health disabilities. And in recent years, we've seen a deeper understanding among legislators about the need to ensure operating and services support for those supportive housing units that have been built. And so there are several areas coming out of this session where we've seen significant jumps ahead in terms of statewide support for supportive housing. And I'll name 4 major areas. First of all, the capital budget. So the capital budget is the state's construction budget, and we have unprecedented investments in housing overall for the lowest income Washingtonians. That includes $175 million in the Housing Trust Fund, which is the state's fund for building permanent housing for people with the lowest incomes, including supportive housing. And new this year, $120 million in addition to that 175 for rapid acquisition of properties, particularly to address homelessness. And that includes emergency shelters and emergency housing, but also permanent supportive housing. So there are general resources to build housing, including supportive housing, and then some more targeted resources to build it quickly, to acquire properties like hotels, like nursing homes, or like private sector apartment buildings that may now be more worthwhile to use as supportive housing. So the capital budget is the first step. The operating budget includes a continuation of $37 million in permanent supportive housing operations, maintenance, and support services dollars. But new this year, due to the passage of a pretty significant bill that is scheduled to be signed this afternoon by the governor, House Bill 1277, there will be significant new resources put forward. A lot of folks think of House Bill 1277 as creating a permanent fund for rent assistance, which it does create, which is exciting. Overall, it creates nearly $300 million a biennium in new resources to address housing stability and homelessness. Of note, related to supportive housing, it includes an additional $58 million in operations, maintenance, and support services. So 37 million ongoing plus 58, that's $95 million. And to think back just 5 years ago, the state operating budget essentially had nothing in terms of ongoing dedicated operating and services dollars for permanent supportive housing. So we've really made significant strides forward. And for folks who are from outside of King County, this is really great news in particular. So we can see more supportive housing not only being built in the metro areas, but also all around the state. So we're very excited about those investments. I do want to say, we often talk about the three legs of the stool, the need to build the housing, to make sure we can operate it, and to provide those voluntary services to folks. Now, you can't build housing if communities don't let you build supportive housing. And there have been issues of getting projects cited, opposition to getting projects cited, or just different levels of comfort across different jurisdictions. Another key piece of policy that we passed this year that is relevant to permanent supportive housing is House Bill 1220. This is a Growth Management Act planning bill predominantly, but it requires that cities that do planning under the Growth Management Act are required to look at the planning for all kinds of affordable housing, including supportive housing, as well as work that for taking inventory, so we'll have a better sense of where permanent supportive housing is being operated around the state. And finally, we have previously passed legislation that required that permanent supportive housing could not be prohibited in any areas where other kinds of multifamily housing are permitted to be constructed. That the House Bill 1220 goes further to say that permanent supportive housing must be allowed in areas where any residential dwellings or hotels are permitted. And so it really solidifies the priority around the planning and land use related to permanent supportive housing. So those are the significant areas of resource, but also policy that will support the creation of additional supportive housing. We're very hopeful in the coming years.
Wonderful. Thank you for that very clear overview. Just as a follow-up, could you tell us what we can do as community members to both keep the advocacy for really scaling the resources, and also to make sure that those resources that you've now appropriated get used for this population?
Yeah, thank you for that. And I'll say, I know we have a number of local elected officials with us today, as well as I think a handful of state electeds as well. And I think making sure that elected officials understand what supportive housing looks like as as developers of housing and or operators of housing work to get those projects built, that they really do engage elected officials in seeing it. That I have been a strong proponent of expanding supportive housing outside of the legislature. I actually work very closely with Daniel Malone at DESC as a citizen legislator. I do have a day job, and it is very much focused on supportive housing. But the interesting thing that I really felt this year is this shift in understanding, and many, many other voices saying that we needed to prioritize supportive housing as the solution for assisting people with behavioral health disabilities, as well as assisting people with long experiences of homelessness. And so the more elected officials understand what supportive housing is, what it looks like in different communities, the better opportunity we'll have to expand it to scale. In terms of how do we make sure the resources are prioritized for this group of people who have the greatest barriers to housing and who will need supportive housing the most, I would say that continued engagement both at the local government level with the government agencies responsible for administering and contracting and monitoring supportive housing, as well as our state agencies. And I think we have representatives from the Department of Commerce here today. And I would include Department of Commerce, as well as the Healthcare Authority, which oversees our behavioral health care services, engaging those folks. They're actually quite willing and wanting to engage with communities across the state to see how this works best, to make sure that those who are making the decisions, who are coming up with the framework and rules, understand what the greatest needs are. We have some statutory framework around the definition of supportive housing and around who is prioritized for supportive housing, but really it comes down to that engagement with the people who are responsible for the decisions that get made about where and how supportive housing works. So I encourage folks to seek out those leaders within their community, elected leaders, as well as the administrative leaders in the appropriate human services or healthcare departments.
Wonderful, thank you so much. And that's a really great segue to our next speaker, Kelly Ryder from King County Department of Community and Human Services. Kelly, you've heard about all this great work and new resources coming from the state. And we also have a lot of opportunities to invest in supportive housing locally. I know it's still in the works, but could you give us a teaser on the regional investments coming from the Health Through Housing initiative and how King County is seeing this align with supportive housing?
Absolutely. Thanks, Debbie. It is hard to follow up on Representative Macri's historic session description, but I'm happy to talk about the excitement we are able to pursue through the Health Through Housing initiative. Last fall, King County really recognized a coalescing of three things, building on our longstanding, what we've already declared as our emergency and homelessness crisis. First, we identified that really moving folks inside into single room settings does limit their ability to spread COVID. And we know that the health benefits of that single room setting don't stop there. As Brooke talked about in the benefits of supportive housing, we know that the improvement that folks see when they're able to move inside their own home and have that stability is significant for their health. And so the executive really wanted to be able to build on what we're seeing as a benefit in the community. Secondly, we had a funding tool in that the state legislature approved a House Bill 1590 last year that allowed King County to implement a new 0.1% sales tax councilmanically. And third, we had an economic recession that we are still trying to climb our way out of. That meant that hotels in particular kind of went on sale. And in addition, the settings that Representative Macri talked about in nursing homes and potentially multifamily apartment buildings, that real estate was more available than historically so. And so building on those three opportunities, the executive and the council approved a package for that 0.1% sales tax for House Bill 1590 to be implemented for our Health Through Housing initiative. That initiative is expected to house 1,600 people, and the goal ultimately is permanent supportive housing. The buildings that we will be acquiring over the next few months and couple of years to do that won't be exactly housing units to begin with. The hotel units that we'll be purchasing may need a little bit of rehab. They may need some help accessing a kitchen. So we're really looking to move folks into emergency housing at the get-go. But the long-term opportunity is absolutely to be able to get 1,600 people into permanent supportive housing, which we're super excited about. The other thing that I'll just name we're super excited about is that this is the one and only tool that I know of that is going to fund all three legs of that financing tool. So we are pleased to be able to make sure that we fund the capital and acquisition costs, the operating costs, and the services costs. I've had the opportunity to talk with communities across King County when we're looking at how will we acquire these buildings, how will we site things, and the number one thing that comes up in my conversations, I would say, is the benefit of those supportive services, and communities really wanting to make sure that when folks have the opportunity to move inside, that they're given the services that they need to thrive in those buildings. And we're excited to be able to do that in partnership with folks like DESC and Plymouth and all of the folks that we know have so much experience with permanent supportive housing across King County. We are partnering very closely with the cities across King County. The executive has been very clear that we will not move forward with an acquisition of a property until we get a green light from a city, both to do a real estate search and then to be able to actually acquire and have a purchase and sale agreement with a property. We think we're getting pretty close in a couple of places, and we're hoping to have some announcements soon at the opportunity to start moving people in to those new buildings.
Wow, that's terrific. I think if everyone was listening carefully, could probably hear this giant collective sigh of relief from providers out there who need that capital, operating, and services to make this work. So that was music to our ears. Andrea Carnes, Executive Director of Plymouth Housing Group, as you hear about these new resources coming through and think about the expansion that's going to be required of your organization, I'd love to hear about, you have already a very substantial pipeline. And as you imagine a future where we might actually be able to go to scale with supportive housing, what does this mean for you as a nonprofit? And what are you going to need from your partners in the broader community and the business community to support your growth as an agency?
Yeah, good question, Debbie. Thank you. And a special shout out to Representative Macri just for all that you accomplished this session. It's phenomenal. And to be on the other side of that as a provider, it's a really exciting opportunity for us to get more people off of the streets. So as you mentioned, Debbie, yeah, we've got about 5 projects in the pipeline. They're all opening in the next 18 months. So this represents 45% growth just for our operations at Plymouth. And in addition to that, we are expanding, as was noted, over to the east side in Bellevue with the Eastgate property. And so we've got new partnerships, we've got new neighborhoods, we've got a lot in the pipeline. And it's a wonderful place to be. It also means that there's a lot of internal changes that have to happen for us to accommodate that level of growth. And there's a lot more people we need to provide the services. So to answer your question just about kind of what's happening and what we need, I would say that one of the things that's become very clear is the need for this expanded focus on health and behavioral health services for people living in permanent supportive housing. So that's a theme that obviously everyone has picked up on and is at the core of some of what we just talked about in the titles of sessions and everything that's in the news. At Plymouth, we're diving in deep to figure out how to meet the needs of our residents within our organization. But I would also encourage us as a whole sector to be looking at how do we create new systems, new supports for behavioral health services that meet the needs, so that we're not individually trying to meet all the needs, but we are collectively have external supports around behavioral health, substance use disorder services, and everything from things like, you know, opportunities for respite options. We've been talking about that. We've been talking about what happens when our designated crisis responders are so overwhelmed that they can't get to people who are in crisis. The access points to be able to get to behavioral health services are a lot of hoops and often not accessible. And so what can we do in our community that really is a collective effort to start fully investing in health and behavioral health services so that PSH can thrive, not only in the sectors and the little neighborhoods where it currently exists, but throughout the county and throughout the state. So I think that's a heavy lift that we have ahead of us together to be able to do that work. And then I would say the other piece is really around developing and compensating our workforce. So when we think about the wages in this sector, this is a huge problem. We run about 25% vacancy for our front desk positions. And just to focus in on that, this is the person who's providing relationship-based services to people who have been traumatized by a lot of other relationships. So they need stability in whoever they're seeing day in, day out. That's what creates that safety environment where people begin to thrive. And so to be able to provide a relationship that stays, a case manager who walks through them for longer than 6 months or a year, right? So the turnover needs to be shorter. The biggest issue we have is wages. And so I would really say that if we could focus in on that. And then the other piece I would say is an investment in professional development. So people come into this sector, oftentimes we're trying intentionally to hire people with lived experience from really diverse backgrounds, and we need to invest in people in their own development. A big shout out to the Social Service Provider Academy at Seattle Central College. It's a really good model for how we could do this in our education institutions and how we could scale that across our state, and some exciting opportunities to build PSH. It's one option. I'm sure there's many, and I think we need to start looking at this from how do we really grow this. I think also HDC has done a lot in this to try to grow leaders, and so continuing to build on that. And then the other area I would say that would matter most to the providers is really around coordination and alignment of funding sources. And that includes both the process of actually accessing grants and also the time and energy we have to spend on the regulations and the oversight. Everything from reporting to kind of ongoing compliance management. It takes a whole team of very skilled people, and that really limits who can do this work. So we need to make this simple. We need to make it something that we don't use all of our resources that could be used for service delivery on managing those dollars, managing that reporting system. So we welcome things like, you know, a standardized format, a shared application, more flexibility, and things that we could even get the private sector to tap into. So if we could create a system that was to scale, we could actually, you know, the foundations, the other private investors, there's opportunity here so that we don't have to chase after all these little individual resources or try to manage individual grants. And then the timeline of those grants is also important because it's like every time you turn around, you've got a different deadline for a different grant. So again, you know, if there's some ability to streamline that and be able to make it easier to access, I think you could expand who can use this and be able to do PSH in other communities. So that's my long-winded answer of saying there's a lot of development for PSH providers in-house and as well in our whole sector to support more growth in this area.
Wonderful, thank you. And we're going to turn to you all in the audience for questions next. But just wanted to highlight a couple of those themes that I heard around, you know, what folks in the field need to take this to scale, and definitely heard from Representative Macri that we need help with siting. And, you know, we know this works, and once it's up and running, it's a real community asset, but that front end, we need as many friends and neighbors out there as possible helping us get supportive housing cited. And Andrea's talked with us a lot about the importance of the infrastructure of the nonprofits that do this work, that know how to do the relationship-based work, and really building the staffing and the capacity and making some of those administrative burdens a little less so they can focus on the hard work. So thank you all so much for this segment. And I look forward now to opening it up to the audience. Patience from HDC is fielding questions for us in the chat. So Patience, what are you seeing there?
Yeah, thank you, Debbie and the panelists. The first question that we have is from Cindy, asking if there could be a basic checklist to compare different supportive housing providers who have different models in the way they provide permanent supportive housing.
Okay, sure. So I think I'm going to take that one if I can use moderator's privilege. And just to say, as a national organization looking at supportive housing across the country, really supportive housing is just one intervention. So the idea that we have all these different ways of doing it usually ends up being more a discussion around the services. So we know it's affordable, deeply affordable housing, and it's always paired with tenancy support services, those services that help people get housed and stay housed. And that's really the foundation of housing stability that supportive housing provides. From there, we have services that are specifically aligned with the needs and the desires of the individuals living in the housing. So they may be behavioral health, they may be assistive technology, they may be senior services, palliative care, they may be employment services or access to education. So those supplemental ancillary services come from a whole variety of systems, public systems that are funding them. And it's important for the supportive housing provider to help provide that foundation of housing to connect to all of those services. In terms of whether there can be standards, we do have a national set of standards at CSH that kind of incorporates all the best practices and evidence bases we know from HUD and from SAMHSA, the Substance Abuse and Mental Health Services Administration at the federal government, and really puts together kind of a baseline that I know the Healthcare Authority in particular in Washington State is looking at. So that's something CSH is exploring further with local and state funders. Looking to the panelists if anyone feels they want to add or if we should move on. Okay, let's do the next question. What a great panel. I know everybody has a great answer for every question, so want to give time for those questions.
Yeah, this next one is from Calvin, and he's talking from his experience. He was released from incarceration over a year ago, and he discovered that most men and women are likely to go back to being incarcerated after a certain period of time. What is being done to help people who are facing difficulties as they get back into the community and to help them be supported?
Chief, you're smiling. You want to take that one?
I'll jump on that one. But I think there's a couple different ways we can look at this. One is what we were talking about earlier with some of the really low-level crimes. What we're often doing in our current system is kicking the can down the road by booking somebody into jail for a day or two, which hasn't done anything to solve the underlying issues, which is why permanent supportive housing is attractive when we're dealing with low-level interactions. We've had great success with our partners here with LEAD and the way that we do LEAD here in Burien. We try to work upstream of the arrest and actually connect people to services before the criminal justice engagement, which is certainly a little different than the post-arrest model that it is kind of set up on, but we try to work upstream as much as we can with our LEAD program. Co-LEAD is another model that we use here, which some of you are familiar with, but that's a housing first model that we've been using hotel properties to get people housed in temporary permanent supportive housing through co-LEAD. And then when you start talking about people incarcerated, you're absolutely right. If you come out of prison and we haven't changed some of those support structures as far as housing is concerned, the odds of being in the same situation that led to prison in the first place we're putting all those factors back in place. So long-term, the jail systems really are focused on how do we do that. And we actually have LEAD embedded in the jail and SCORE here, but that's not per se prison, but jail. But it is certainly something that we should be really focusing on is getting that access to housing to prevent some of those factors that led to the negative decisions in the first place. Obviously, I understand a lot of time crimes are crimes of poverty and not crimes of deviance. So.
Thank you, Chief. Thanks very much. Patience, what do we have next?
Yes, there's been a question, sort of a thematic issue around behavioral health issues that are experienced by people, whether it's with their neighbors or just themselves. And the question has been, how do we ensure that we have a comprehensive behavioral health strategy while we are increasing support for permanent supportive housing in our communities?
Great, thank you. Elisa, you want to start on that one? Okay, you're muted.
Sorry, I wanted to speak to the need of that, and I totally agree. I think that's one of our, with the defunding of mental health more recently, we really have to bump that back up again and really look at the acuity of the people that we are serving. And I think when Andrea spoke about, the wages and the training that's needed for our staff is super, super important. I know in the shelter alone, where mental health is a huge issue, and we're always hunting for funding. That's a really difficult thing. I think we need that in every part. When we meet them on the streets, we have to have people, which we do. When they're talking to their case managers, they have to be well trained to handle the mental health issues all the way through into permanent supportive housing. And I think it's going to go back to when we're looking at the health through housing initiative going on with the county and the money from the state. It's essential that we have to put in some money for mental health services.
Thank you. And I see a couple of hands raised, Representative Macri and Daniel. This is such an important foundational issue when we talk about the needs of people with these healthcare needs. So I'll give everybody a little space. Representative Macri.
Yeah, I think a lot of times we hear this comment that supportive housing is the most complicated and expensive kind of homeless intervention to create and sustain. We know, though, it is the most successful for people with behavioral health disabilities who also have experiences of homelessness. And we know when we look at the sort of mainstream behavioral health interventions for a similar group of people, those interventions tend to be a lot more expensive, and the cost of not providing ongoing stable housing and those ongoing outpatient type voluntary behavioral health services is that people are more likely to go into crisis, more likely to be hospitalized, sometimes hospitalized against their will. And so investments in supportive housing, including those behavioral health services that can be brought to people in their housing setting, are really, really essential. I think we've made strides at the state level related to that. There are a few things that I think have ancillary benefit or direct benefit to the supportive housing movement that also happened this session, including the continuation of the foundational communities supports. So having our healthcare authority go to the federal government and negotiate a continuation of this Medicaid waiver that we have that allows us to use Medicaid funded support services and permanent supportive housing. And to go along with that, what we've heard from providers around the state is, yeah, services for supportive housing are great, but there's no housing people can afford. So in addition to the investments we talked about, we included enough resource for essentially 500 placements in supportive housing, be them scattered site through the community or project-based in buildings that are being created to provide ongoing resource to be paired with the foundational community supports permanent supportive housing benefits. So, and we did that as we were looking at the behavioral health budget. So really looking at that nexus between housing and behavioral health. I think more and more legislators are doing that. And I think as we look to partner with local governments, some of whom are responsible for, particularly at the county level, carrying out some of the crisis-related services related to behavioral health, and partnering with cities that say we want more behavioral health services, but we are not responsible for that, or we don't have the connectivity to those resources. Really, I think permanent supportive housing is the place where all these levels of government come together and can work together to serve the needs of community, because nobody wants to see the challenges that people who are living with serious behavioral health disabilities experience, particularly when they're doing so while homeless.
Thank you very much. Daniel, would you like to add more from a provider perspective?
Yeah, thank you. So it's an extremely important issue. I think there is a fundamental disconnect between the typical ways that our behavioral health care system provides services to people and needs on the ground. So we spend a ton of money on hospitalizing people, very expensive care, but it's time limited, and people need ongoing support, not just support while they're in the hospital. And then the outpatient system, by and large, is funded so poorly that the only way to make it work usually is to have clinic-based settings that allow you to have a high volume of service being delivered, kind of like a primary care doctor's office. And that doesn't touch the population that isn't eager to come into the clinic for appointments like that. And so we need a behavioral health system that is much more flexible, that brings behavioral health providers, clinicians to where people are in the community, including in supportive housing. Now, supportive housing produces tremendous benefits for people, but it does not cure mental illness, for example. And so people do need ongoing care and support. And if we expect them to be able to get it, we've got to find much, much better ways to bring it to them. DESE, we have some advantages in that area because we ourselves are a licensed behavioral health provider, and we have some ability to be more mobile and cite some of our behavioral health services where our clients are, but it's not scaled to the full amount of the need to do it that way. And it's certainly not scaled to do that beyond DESE's housing. One of the programs we operate in King County is called the Mobile Crisis Team, where we get calls about people in psychiatric and other behavioral health crisis 24/7. And we go out and provide some kind of immediate intervention for folks. The vast majority of calls are for people currently experiencing homelessness. So we continue to create these, pricey and suboptimal crisis response systems to help people when we could give ourselves a tremendous advantage if we housed everybody, and then they'll still need care and support, but they'll need it less frequently in less intensive ways, which makes it more possible to get it done that way. But we find ourselves just spinning right now because so many people are in crisis.
Great point. I saw lots of heads nodding with your points. Thank you. Yeah. Patience, what's our next question?
Yeah, I think Daniel touched on a lot of this, but there's a question around what are the outcomes of supportive housing and how long do people stay housed? I think that really takes us back to the level setting intent for this event.
Great. Andrea or Daniel, tell us about it.
I'm happy to jump in and start. We talk a lot in our sector about this. So here's what I would say for context. Majority of the people who move into our housing, this is the last place they live because they pass away in our housing. So it is a permanent option. We tend to serve people with a lot more health issues to begin with. So people move in very ill oftentimes with some significant chronic health conditions. And then we're serving people through their end of their life. In terms of actual success rate, so I think we have a phenomenal success rate in permanent supportive housing across this whole sector. I know that ours at Plymouth is about 96, 97% people remain housed when they move in. And so what we consider an unsuccessful move out would be anyone who returned to the streets. And we run around 3 to 4%. When you consider it's no barriers to move in, it's housing first model. We take you in the door with whatever you're bringing with you, and we serve you in that space. So I think it's a really remarkable place to be, and we have a model that really wraps around people. I know DESC is doing the same work and has a lot of, we share similar outcomes. I think the whole sector serves permanent supportive housing in this sector has really been a successful tool. I put in the chat too, just a context of what it's costing you. I think that all of us need to be voting with our dollars all the time when you think about paying taxes. And I think this is an important thing to know, is that this is not only the most economical way to serve this population, it is also the most humane, the most successful, right? So there's all of these case studies that can tell you that this is really the best approach. And I'm probably, preaching to the choir here, right? It's a whole lot of people who are already on board, but I think it's important that all of us are armed with that detail as you go out and talk to people who might not be, because it really makes a difference, particularly in the business sector, to get people on board, is to be able to help them understand you're going to pay for this person in a variety of settings. Which setting do you want? And here's an opportunity for you to partner and to do something that really makes a difference for the individual, makes a difference for the community, and really can come alongside these providers to be able to do this good work.
Beautifully put, thank you. And I see other panelists adding information to the chat. Thank you. The fact that supportive housing and Housing First are data informed, and you as executive director know off the top of your head what the outcomes are, just says a lot about how rooted in outcomes this intervention is. Thank you. Back to you, Patience.
Yes, there was another question by Liz that says, how does market rate housing fit into this model? Is this only a subsidized housing tool? Okay,
I'll quickly answer the second part while I look around for someone to raise their hand on the second, but the first. It is subsidized housing, and the reason it's always subsidized is because it really is reaching the needs of people who have extremely low incomes. And that means that they're less than 30% of the average income in your community. It means they're usually on a fixed income, as Brooke mentioned, Social Security income. And in our communities across King County, there simply are no more apartments that are affordable to that group. So we either raise wages or we raise housing subsidies, but for this group, those housing subsidies are critical to get back into housing. Anyone else want to talk about how supportive housing might be integrated with other affordable housing?
Yes, I have a vision, and I think it would be absolutely wonderful if we had more community type of environments where we would have some people with some permanent supportive housing and possibly some families, some seniors, to where it would be more of a co-housing type of dream. I don't think there's anything on the books now, but I don't think that's anything that needs to hold us back. I think if we can create more community that cares about one another, maybe we could start something great.
Thanks, Elisa. Kelly, you fund both affordable, your agency funds both affordable and deeply affordable housing with services, supportive housing. Can you talk a little bit about that intersection?
Sure. I think, as has been named throughout the discussion, it really takes a range of options. We know that folks with severe disabilities and very low incomes really thrive in permanent supportive housing units, but we also know that there are lots of folks with behavioral health conditions that are housed every day in single family homes and across our communities. And so we need the housing to match the range of community needs that we have. And I think it's great that we're really spending this time today focusing on permanent supportive housing, where we really just need a lot more. And that's totally in a spectrum where King County invests a lot of funds over the last few years in transit-oriented development housing and making sure that there's housing available for our workforce, and especially our lower income workforce, connected to transit, connected with education opportunities. And so it's really just making sure that we have that right housing fit for the needs of all of our residents across the region.
Great, thank you both. Patients, it looks like we have time for maybe one more question.
Yeah, and the final question is, how can communities best work to support permanent supportive housing in their own backyards? Can you identify ways that they can collectively develop good models to support permanent supportive housing?
So I'm happy to get us started, but I know DESC and Plymouth probably have lots more to add. I would just say I am out right now talking with communities about the opportunity to site a health through housing building in jurisdictions across the county. So especially for any local electeds that haven't talked to us about that opportunity, would love to have that conversation. And I know, neighbors across the region are also saying the same thing about how do we make sure that we support our community. So I think all of us here are probably happy to be resources for folks who want to bring permanent supportive housing to meet those needs.
Well put. All right, I think that's.
I think Andrea has a comment.
Yeah, thank you. Really quickly. Again, I would just, like to echo that it starts with the conversation, right? Then when a project is met with opposition, it's often, because there has not been a relationship built authentically within the community. And so it's really important that we invite more voices and people at the table to be part of that solution finding and build those true, authentic, collaborative partnerships. So that when an opportunity does present itself, it's an easier conversation to have than something that was a surprise, right?
Great point. Thank you. And I'm going to turn it back over to Marty and HDC, but Andrea, you kind of set the stage for us about what the broader community needs to know about supportive housing. How did we do today? Are we on track, and where do we go from here?
Yeah, well, I appreciate that question. I think it's a start, right? I mean, I think that having an opportunity to share perspectives and share insight and share data, inviting more stakeholders to be part of the conversation, to share in just a true, authentic way is a great first step. So I'm excited to be, part of the conversation and look forward to increased collaborations and partnerships. As we know, we need more tools in this toolbox if we're going to really solve the housing crisis in the Puget Sound. So appreciate the opportunity.
Thank you. And I'd like to ask everybody to give our panelists a big round of applause, either virtually, my dog's chiming in too to say great job, everybody. And really thank you. Your diverse perspectives and expertise are just amazing to know that we have in our community. And I saw some questions in the chat about the slides. We'll be sure that you get them and access to resources from any of our presenters. With that, thank you again, HCC and Marty. Turn it over to you and Allison to wrap us up.
Wonderful. Well, thank you, Debbie, for moderating, and especially for our panelists for all the hard work that they put into participating with you, as well as the staff and others who made this possible. I'm just going to pick up on a couple of notes here before I hand it off to Allison to talk about next steps. When we initially started Affordable Housing Week a few years back, the reason why we're doing this is to help local community members support local elected officials in taking as much action as they possibly can in their communities to make it possible for there to be more affordable housing. So this is not intended to be a federal or state initiative. It's intended to really help us address local policies and local opportunities. You can probably tell by now, for those of you who are new to this circle, and for those of you who have been around a long time, that the issue of siting permanent supportive housing throughout the county, throughout the region, is something that is of paramount importance to all of us as a community. And as you listen today, I know you got a good flavor of the very eclectic and diverse needs of how we address this issue. Chief Boe talking very specifically and forthrightly about acknowledging the fears and the misunderstandings that exist in community, and Andrea opening up about the needs and the opportunities with business. When I think about what we're facing, one of the things that I'm most concerned about is how we as civil society have basically abdicated our responsibilities for behavioral and mental health and for housing to agencies. We have created an institutional mindset for something that should be resolved and owned by all of us in community. And so if there's any charge that I leave us with today, it is that each one of us needs to figure out within our own circles of influence about how you spread the word, how you reduce the myths, reduce the fears, acknowledge them. I've watched Daniel do this in public where he doesn't try to argue with people or deny the fact that people actually do have fears and concerns about permanent supportive housing. We need to be honest, and we need to get more people aware, and we need to do something about this with some level of urgency. It's great that we've now got more resources. We're going to have to redouble our efforts in every community to help every single council member and mayor and planning commission understand what we're talking about here, and we need to do it tomorrow. And with that, I'm handing it off to Allison Eisinger of the Coalition on Homelessness, who's touching this work every day to wrap us up. Thank you, Allison.
Thank you so much, Marty and everyone. I will attempt to do this very quickly. If you're still on this Zoom call, please hang on for one more moment, because there's an important piece of the next steps that really depends on each of you and all of us. And that is to take just a couple minutes to click on the survey link that Patience just put into the chat and tell us what remaining questions you have, what additional information and resources would be helpful. But I'm going to ask you to be very specific. If you're an elected official or staff for an elected official, or if you're running for public office, what do you need to learn more about your role as a public official or public servant to advance the solutions that we have been hearing about today? If you're a service provider or housing provider, what are some things that help you explain the crucial nature of the work that you do to your friends, neighbors, and family members in regular language? And if you are someone for whom this is new, please let us know what resonated for you, what information was news to you, and what you'd like to hear more of. Our work is to not just envision, but to create a region where everyone acts on a shared sense of responsibility to ensure that everyone has a home. You know how important that is, because you have probably been fortunate enough to be able to stay home and stay healthy during this crisis of COVID-19. But what we need is a region in which every person has the ability to stay home, stay healthy, and create community and interact in an environment where our individual health and our collective health are bound up together. So thank you so much to everyone who spoke, who brought your invaluable personal and professional perspective to this work. I'm very excited to continue the partnership to think about what our next sessions could look and sound like. I think we should think about bringing the voices of people who live in supportive housing to these conversations, and also the voices of some of the people who are waiting for homes. We can't leave people waiting for longer. So I'm excited to work with all of you to continue our shared learning and action. And with that, thank you so much to the people who did tremendous work to prepare today's session and all of the wonderful additional events that are going to be part of Affordable Housing Week. And I thank you all very much for your engagement, your your effort, and your attention.